Hi, I'm Kendra Vallone. As a professional golfer, we're very familiar with injuries, especially back injuries. So today I wanted to introduce you to Dr. Choll Kim, who is one of the most renowned spine surgeons in San Diego, known for his minimally invasive techniques, which are fantastic for athletes or anybody that's really active. So Dr. Choll Kim, thank you so much for coming with us today.
Thanks for having me.
And one of the most probably important issues that we come up on for athletes is herniated discs. So can you tell me a little bit about that? What is a herniated disc?
That is unfortunately a very common problem in active individuals, especially people that do a high level of sports. And professional athletes especially get herniated discs. And basically what's happening is that our spine is made up of these bones that are stacked on top of each other, and they're separated by these shock absorbing discs.
Okay.
That allows us to stand upright and then do activities that involve a lot of jumping and stopping and hard movements. Unfortunately, those discs are made of a kind of rubbery material. It's made out of collagen, but over time and with repeated activity and wear and tear, a little piece can squirt out the back. That's called a disc herniation. And when that happens, it can pinch the nerve that goes down your leg, for example, or even down your arm. And it tends to cause a lot of pain both in your back and the pinched nerve pain that goes down your leg that we call sciatica. So unfortunately, it's a very common problem, and it's part of our aging process when those discs degenerate, and that process is accelerated when we put a lot of wear and tear on those discs through activities, especially sports.
So Dr. Kim, as an athlete or somebody that's really busy, I'm sure there are a lot of CEOs and high executives that don't feel, perhaps they don't have the time to go to the gym and they end up in this situation. Is there a better surgery, perhaps like a laser related surgery that can get them in and out and to recovery a lot quicker?
There is. It's relatively new, but my preferred way to treat a herniated disc in people that need to get back to activities quickly, or high level athletes that need full function of their paraspinal muscles, I prefer to do the surgery using a technique called laser endoscopic spine surgery. And that surgery is different than the traditional microdiscectomy in that the incision is much smaller. Instead of being necessarily in the middle, it starts off to the side of the back so that you can bypass these powerful muscles. And through a small channel, really the size of your pen, we can put an endoscope, and through that endoscope we can put very small instruments like the side-firing laser and the radio frequency probes, and instead of using mechanical tools to remove the disc, we can shrink and vaporize the disc using more advanced technology like lasers and radio frequency probes. That surgery allows a much faster recovery. So if you need to have surgery, for example, on a Friday and be back to some type of work on Monday, that would be the surgery to do. When we do the endoscopic surgery, I think that long term we'll have a lot less scarring and a lot less instability. So it's not only for rapid short-term recovery, but I think for long-term recovery, I would personally rather have a more minimally invasive surgery so that that disc isn't damaged and all the surrounding tissues that provide support to that disc isn't damaged, so that long-term I don't have problems with that same disc because of the fact that we did a surgery that causes trauma and inflammation and bleeding and scarring in the process of doing the surgery.
So how quick are we getting back on the golf course after something like this?
Depending on what your level of play, I would recommend what I call a accelerated rehabilitation program. So you spend about a week just taking it easy right after surgery, and then at the end of the first week you start a gradual increase in activities using a really good physical therapist, and hopefully you can be back on the course at the second or third week. And if you are trying to get to a tournament or do something high level, around 6 weeks is usually the time period where most people can get back to high level of play. It differs from person to person and from disc herniation to disc herniation, but that would be a rough estimate. If I performed a microdiscectomy, which is the more traditional surgery for herniated disc, that recovery changes significantly. For 2 weeks, I just have them take it easy. I want all the tissues to calm down, and I really don't recommend high level of play until at least 3 months, not 6 months.
Wow, that's a big difference.
So for somebody that has a very strict timeline, that's a really important consideration in trying to decide between a traditional surgery and a no-invasive surgery.
Thank you, Dr. Choll Kim, for spending some time with us today, talking to us about herniated discs. We really appreciate your time. So hopefully we get to spend more time with you soon, and we can learn more about your other procedures that you have.
Thank you for having me. I hope that was helpful and informative, and I hope people watching will take care of their back, stay healthy and fit, so that we can stay active for a very long time.
Absolutely, and get right back on the golf course.